I would like to go ahead and introduce our next speaker. Is Dr. Danielle Aufiero. She's the partner of Steve Sampson, and she's been practicing regenerative medicine for some time, about 6 years. She's an instructor of clinical medicine at the Geffen School of Medicine, UCLA, and just a great wealth of experience. So please welcome Dr. Aufiero.
So I chose this particular patient for this clinical observation. I just thought it would be interesting to mix it up a little bit. Instead of just talking about rotator cuff and knee OA, I chose a patient with thoracic spine pain, rib pain particularly, and I'll get into the history on the video. So I won't waste too much time right now. At the end, just for the sake of time, we'll just limit questions, and whoever has any further questions can come find me at lunch, and I'll be happy to discuss further. So we can roll the video now.
Hi, Jill. I'm going to get started with drawing your blood, okay? Here I go. 1, 2, 3. That's it. And I can tell you're well hydrated. Your blood's flowing perfectly. Doing great. All done. That was fast, right? Now we're ready to put Jill's blood to spin using the M-Site kit. You want to make sure the counterbalance matches the exact amount of blood in both chambers before putting them to spin. Now we're ready to start processing the Pure Prp with the BioRich M-Site system. The first spin is for 1.5 minutes, 1.5, at 3,800 RPMs. You always want to make sure you get rid of that little red or the blood that's stuck in the tube there to keep this pure. So I just take a 10 cc syringe and aspirate, and then we want to make sure we get rid of all the RBCs. So by doing that, we are sure that we don't have any excess blood. The closer I get towards the red blood cells, I just start slowing down. We want to make sure we don't get any of the RBCs. And now we put it into the next chamber. The really nice thing about this chamber is a closed cap. It keeps everything sterile, keeps the patient's platelets sterile. And now we're going to put this to spin for 5 minutes, 3,800 RPMs. That was a total spin time of 6.5 minutes. And now we get rid of the platelet pore, which is this part. We draw out all of the PPP, the platelet pore, leaving either 7 or 8 cc's, depending on the doctor, what they're going to inject. And you can always adjust if you need more or less. I add a 10 cc syringe to the top. Since platelets are sticky, they get stuck at the bottom, and we just want to make sure we mix them nice. They get stuck to the red blood cells, the 1% red blood cells, so we pretty much got all of it. Now the Pure Prp is ready to be injected. With the platelet pore, we're going to use the BioRich ProPlas kit. Very simple. So we attach these 2 connectors on each end, then a 10 cc syringe on the top. We start putting the platelet pore that's full of proteins. The reason why I'm doing this slowly, and I'm not connecting anything on top of here yet, I'm getting rid of all of the excess air to avoid any extra bubbles when we're injecting. Each time I'm putting this through, it's getting rid of the extra water molecules and concentrating the proteins to make a nice scaffold or matrix when injecting the PRP. And we need 4 cc, so we're down to 5. So you want to just keep doing this back and forth until the desired amount. Now we're ready to inject.
So now we will be injecting Jill. She's an 18-year-old competitive rower. She has history of left-sided thoracic spine pain posteriorly over the last couple of years, intermittently, as a result of repetitive microtrauma from rowing. She's been treated with physical therapy, modalities, chiropractics, and ultimately it started to interfere with her activities of daily living in addition to her rowing. So she sought treatment from me for further evaluation, specifically for PRP. Her chiropractor would find that T4 through T8 ribs at the costovertebral joints would be subluxed posteriorly, and this would require him to manually have to adjust her on a frequent basis. So Jill has already had a couple of PRPs that have worked very effectively for her, and we're just trying to see if we can get her to 100%. She's almost there. So I will be injecting BioRich M-Site Pure Prp into T4 through T8 costovertebral joints, and I'll be injecting about 1.5 cc's combined Pure Prp with Proplas. So we'll get started. I'll be using a 2-inch 25 gauge hooked up to a catheter and give some topical 1% lidocaine diluted with saline as I make my way down into the joint. In addition to the achiness and discomfort she was experiencing on the left side, she started experiencing burning and radiating pain around the torso, consistent with intercostal neuralgia. When undergoing intercostal nerve blocks, this provided only very temporary relief. So the working diagnosis is that the costovertebral joint instability and tendency to sublux causes irritation of the underlying intercostal nerves. And so far, there's been a significant dimming of that type of neuropathic pain. She also has a couple of trigger points along the mid-axillary line in the intercostals. So I'll just have my ultrasound technician, Amina, point out a couple of key structures so you know what you're looking at. First, we'll point to the spinous process, that pointed structure right there. Then, if you look towards the left, there's a small divot where the rib joint is, and Amina's pointing to that right now. Then underneath that, you could see hyperechoic movement, and that's the pleura. All right, Jill, so a little cold spray. Little pinch, 1, 2, 3, poke. So now I'm going to inject a little bit of the lidocaine just to make it more comfortable. I will not be injecting lidocaine directly into the joint. So now I'm going to switch over, and this is combined Pure Prp and Proplas. 2.75 cc's of Pure Prp and 0.25 cc's of Proplas. Okay, a little pressure here, 1, 2, 3. So I'm just doing very gentle peppering, not too aggressively because of the area that we're in. And I've injected about 1 cc. All right, one more to go of these, okay, Jill? And then we just have the trigger points on the side. You can just see that white shadow of the needle, a little tip making its way. We're about to get right into the joint, so I'm going to switch it over. And then another 0.5 cc. And then we'll wash it through with the local. We completed the costovertebral joints. At this point, we are going to switch gears and do neural prolotherapy, which is John Liftoff's discovery, and I'll be targeting the dorsal rami of the affected segments and the tender points along the intercostal nerves that match up with her area of pain. This can enhance healing by ensuring that the nerves are as disinflamed as possible. Okay, so I have the neural prolotherapy syringes. We typically use 3 cc syringes, 2.75 cc's of sterile water and 0.25 cc's of mannitol, and we attach it to a 30 gauge. So this is a subcutaneous injection. These are not deep. The ultrasound actually gets in the way, so these are done without image guidance. And then I'll just re-prep a little alcohol. So I'm just going to spray the area. First we'll do the dorsal rami against the spine. And then I typically pinch the skin a little to distract. I just let the skin relax. Typically for the dorsal rami, you have to just go a little bit deeper with the needle, and you do about 1 cc per area. And you can see as I inject, I'm just coming out slightly to form that bolus that John Liftoff describes. We'll do those 3 more areas. Little pinch. Just lifting up out of the skin. Okay. And then we just have a few more areas over here. So these I don't go as deep. And then just 2 more spots on the outside that matched with her area of pain. A little more cold spray. 1, 2, 3. Okay, good. All right, and that's what it'll look like, little tiny boluses. So at this point, we're going to reposition Jill on her side so we could finish up with the last 2 trigger points and those intercostal muscles. Okay, so now we have Jill lying on her side, and we have intercostal muscles up on our screen. We're actually able to get both of her trigger points with 1 needle entry. So this will be the final needle for this procedure. I'll be injecting about 1 to 1.5 cc's of the Pure Prp Pro combo, 25 gauge, 1.5 inch. A little cold spray. How's the discomfort level? It's okay? Okay. And then I'm basically just going to spread it out over this whole plane. So this concludes Jill's procedure. And in summary, we injected Pure Prp and Prolotherapy into T4 through T8 costovertebral joints and overlying paraspinals, as well as trigger points in the intercostal muscles in the mid-axillary line, and neural prolotherapy. Okay, great. So you guys can come find me at lunch if any questions pop up.